Okay, let's get started. Welcome, everyone, to the Deep Dive.
Glad to be here.
Today, we're tackling a specific topic in veterinary medicine using the sources you sent over.
Right. Canine and feline plasmacytoma.
Exactly, and really focusing on that mucocutaneous form, mostly. Our job, as always, is to walk through these materials, pull out the key info, so you really get a handle on this condition.
And it's interesting, right away, the sources really emphasize that for dogs, it's much rarer in cats. Apparently, this is usually, a benign thing.
To tumor plasma cells, yeah.
But the ones on the skin or mouth, they tend to respond really well to just local treatment.
That usually benign point feels super important because the sources pretty quickly draw a distinction, don't they?
They do.
There's this other, less common type, the gastrointestinal one, GIEMP.
Yes, gastrointestinal extramedullary plasmacytoma, and that one can act more aggressively. The sources are quite clear on that potential.
Gotcha. So understanding that difference right at the start is, well, it seems crucial. It changes the perspective.
Completely. Affects diagnosis, treatment, the whole outlook, as the papers suggest.
Okay, so let's stick with the common one first, the extramedullary kind, not in the GI tract. Where do the sources say we usually find these? They give percentages.
Yeah, they break it down. About 86% are cutaneous, so on the skin somewhere.
Talk about the vast majority.
Then another 9% or so are on mucous membranes, think mouth, lips, that area.
Right.
Smaller numbers, like 4%, turn up in the colon or rectum, and only like 1% elsewhere. So
Right.
overwhelmingly, it's skin and mouth.
And if you were to, see one, what do the sources say it typically looks like?
Usually solitary, just one smooth, kind of raised pink nodules.
Okay.
And generally quite small, often just 1 or 2 centimeters across. That fits for the skin and the mouth ones.
Makes sense. But then, obviously, if it's in those other spots, like the colorectal area, the signs are totally different. Bleeding, straining, maybe.
Exactly. And for that GIEMP type we mentioned, the signs can be really vague, non-specific things like weight loss or vomiting. Location is key.
Which naturally leads to asking, what causes them?
And the answer from these sources is, we don't really know.
Okay. Causes, risk factors, it's just not detailed in this material.
Nope, unknown. Which puts the focus squarely on finding them, right? Diagnosis.
So how do vets typically diagnose these based on these articles?
Cytology comes up first. Fine needle aspirate.
Sticking a needle in, getting some cells?
Yep. And the description is pretty specific. Moderate to high numbers of cells. They're roundish, clear borders, and that classic, really deep blue cytoplasm.
That royal blue color, I remember that from pathology.
Exactly. And often a little clear zone right next to the nucleus.
The paranuclear clear zone, got it. Sounds very characteristic.
They also mention seeing multiple nuclei in one cell sometimes. And histology, looking at tissue sections, is mentioned too, classifying cells as mature blastic.
Right, but then there's a really interesting point the sources make about that classification.
Oh, yeah. This is quite surprising. They state pretty clearly that how those cells look under the microscope, that histological grade, it doesn't actually predict the outcome.
So calling it blastic doesn't mean it's necessarily worse for these specific tumors.
Not for prognosis, no. Which is, maybe a bit counterintuitive.
Definitely. Now, going back to that GI form, the potentially trickier one, the sources hint diagnosis might involve more steps.
That's right. For GIEMP, they bring up things like checking the bone marrow or doing serum electrophoresis, basically looking for signs the disease might be more widespread.
Systemic involvement.
Yeah. And imaging becomes more important too. Maybe a colonoscopy if it's colorectal, or chest x-rays and abdominal ultrasound for the GIEMP, checking for spread.
Okay, so diagnosis can be more involved there. What about treatment? What do the sources say?
For most of them, the skin and mouth ones, it sounds pretty straightforward. Conservative surgery is the go-to.
Just cut it out.
And often that's curative. The sources say radiation is an alternative if surgery isn't a good option for some reason.
Okay. And for the GI form, does treatment change?
It might, yeah. Surgery is still often part of it, but they mention chemotherapy, melphalan, and prednisone specifically might be needed as well.
A more systemic approach for a potentially more systemic problem.
Makes sense, doesn't it? Reflects the different potential behavior.
So prognosis-wise, pulling it all together, sounds pretty good for the common types, based on this info.
Very good, actually. Excellent is the word used for the mucocutaneous forms. Long-term survival expected.
That's great news.
Recurrence after just cutting it out is low, around 5%. And spread metastasis is really rare, maybe 2% of cases.
Wow. Okay.
Even for the colorectal type, treated just with surgery, they report a median survival of about 15 months, which isn't bad. And for the GI-EMP treated with surgery, with or without chemo, the sources also suggest long-term survival is expected.
Okay, so let's boil this down. What are the absolute must-know points from this deep dive into the sources?
I'd say plasmacytoma on the skin or mouth in pets. Usually benign,
Yeah.
usually just needs simple surgery. Prognosis, excellent.
Right. And we know what to look for under the microscope, that blue cytoplasm, the clear zone.
And crucially, that histological grading doesn't predict how it'll behave for these specific tumors.
Don't get thrown off by the grading. And then the big BUT.
But the GI form can be different, more aggressive sometimes, needs maybe more diagnostic tests, potentially chemo along with surgery.
Understanding those two paths, the common, easy one, and the less common, potentially more complex one that really clarifies things, doesn't it? It helps make sense of why different tests or treatments might be mentioned.
Exactly. You see the typical scenario and the important exception the sources highlight.
Absolutely. Okay, final thought then. The sources are quite clear.
Hmm.
Causes, risk factors, unknown.
Yeah, bit of black box there.
So that leaves us, and you listening, with something to think about. If we don't know the why behind these tumors, what kind of research down the line might actually start to unravel the origins of this specific plasma cell cancer in our pets? What needs to happen next?
Interesting question to ponder.